cancer,
measles, diabetes, AIDS, cancer,
Good evening once again, folks, and welcome to our live edition of Doctor on Call for this evening. It is the 21st of July 2020. This evening we're discussing primary health care. Of course, an area of public health that is very, very, very important. And we have with us this evening our good friend, no stranger to our program. He is a lecturer at St. George's University in the area of public health, Mr. Kennedy Roberts.
Trying to do what I think is best, not just for me and my family, but for my community and country. And so I'm working at it one day at a time.
That's wonderful. And let me also welcome our viewers on GBN Television Channel 7 and 11, and of course all our listeners of K105. So this evening, Kerry, we want to talk about, of course, public health, but with special emphasis on primary health care. And let me start by asking you, when we speak of primary health care, what do we mean by that?
Okay. Good evening, listeners and viewers, and it's a pleasure to be here to talk about health issues. And primary health care means that first point within the health system where the focus is on preventing diseases. It's on promoting health and prolonging life. So the emphasis is on not waiting till you get sick, but trying to look at the factors that contribute to us becoming ill and dealing with those issues early enough. And as a word, primary healthcare, the first point of healthcare, because you have primary, secondary, and tertiary. Primary focuses on prevention, secondary health is more on hospitalization, and tertiary health is on the specialized areas of health. So when we talk about primary healthcare, we focus in more on prevention. That's the simple, straightforward.
Right, and why is that so very important? Because even at the level of the World Health Organization, they have also emphasized the importance of primary health care. What about that? I mean, yes, prevention, we understand that, but why is it so important?
Well, primary health care is not just about the health system. It's about involving other stakeholders. So, for example, your water quality is an important dimension of primary health care. The amount of rodents and so in your community and the impact that has on disease is an important part. The issue of cleaning your environment to reduce the burden of mosquitoes, the Aedes aegypti in particular, in our situation that is responsible for dengue. We need to focus on that. We have to look at the agricultural system and nutrition, and how do we really deal with the nutrition of the population. So when it comes to primary health care, it addresses what is called the determinants of health, the factors that contribute to your health status that is outside of the Ministry of Health. So we have to show the linkages with the school health, with workers' health, with the health of the elderly, with mental health, and all the dimensions that focus on well-being, on enjoying a quality of life that make you a productive citizen. And that is why you cannot wait until a person is an adult to focus on their health. You have to deal with it from our maternal and child health program, from the time the woman is pregnant, ensuring that she has a strong, healthy baby, And in that first 5 years of the life of the baby, to ensure that the brain focuses on the growth and development to lead to a productive adult life. So when we talk about primary health care, we really talk about keeping people as healthy as possible and reducing the likelihood of them getting sick later on.
Right, and that being said, now we know that there are a lot of people who really cannot afford healthcare, or what we may call what I want to refer to as essential or good healthcare. For example, you get sick, you don't have the money to pay for operation, you don't have the money to pay for medication, and all of that. You may need to see a specialist, you may need surgery, and you don't have the money to do that. Let us put that into context with primary health care.
All right. Once you reach the stage of visiting a doctor because you're sick, it means that you have moved beyond prevention and you're now addressing the healthcare needs based on an ailment. So it is an important component of our health system because we must acknowledge that people will get sick. People must have access to a doctor. People must want to access the health services to get well when they have a health problem. But primary health care tries to identify your potential health problem early and deal with it. So for example, we know that chronic diseases bears a significant burden on our population: diabetes, hypertension, obesity, cancers. So what can we do to minimize the risk of persons becoming diabetic later on in life? We need to talk about education. Health promotion and health education is the main focus, and it doesn't cost too much to educate the population through various means. Social media is now available to us. Everybody has a cell phone. We have to be creative and provide information to the population that would help remind them of what needs to be done to remain healthy. But once you get to the stage of visiting a doctor, that means your health system needs to provide the facilities, the services, so that people can access. So the point of contact should be your community, your district health center. In Grenada, we have a range of health facilities throughout the country. What is the level of staffing at those facilities? Do we have the community health aides that go out in the community and monitor what is going on to be that link between the community and the health center? What is the role of our district medical officer? Is it just to sit in a clinic and see patients, or is it trying to talk about the wellness of your population in your catchment area? So we have to really appreciate the importance of health promotion, health education, and ensuring that you have the support services to address health problems when people get sick.
Right. Now, Kennedy, everyone is entitled to health care. You know, and I think that there are dual roles here in ensuring that, you know, primary health care is what it's supposed to be. I think our community, and you mentioned that, our community has a responsibility, and our leaders or central government or Ministry of Health, whatever you want to call it, their responsibilities there. I want us to look at the two sets of responsibilities in ensuring that the best primary health care is available. So we can look at the community level. In other words, as a people, our responsibility. What is it we need to do? What is it we need not to do? And as it relates to our leaders, our ministry, policymakers, what's their role? What are the things that they need to do, and what are the things they need not do? Let's look at those and put into context.
Well, you look at the spectrum, because there is the what we call the ecological model that gives us a basis to analyze the health of populations. So they advocate that at the first level, as individuals, we have individual responsibility. We should be knowledgeable about the things that would harm our health. So if we continue smoking cigarettes, we know tobacco has an adverse impact on your health status. When we look at the level of alcohol consumption, we know that that has a negative impact on our health status. When we look at the lack of exercise and activities to stimulate the body, we know that that has an impact. When you look at your diet, what you eat, what you consume, what you put in your body has an important impact. So as individuals, we have an important role. But the next level is at your family level. The children in a family cannot eat what the parents do not give them to eat. So if parents produce healthy diets, healthy meals, and encourage the children to enjoy local produce and cook things in a manner that it makes it attractive for them, children would eat healthier. But if you're giving them the popcorn and the Zumas and the KFC and the sort of things that we know is not healthy for us, the fried foods and the burgers, and so we have to acknowledge what impact that would have on. So at the family level, and your friends and the colleagues that you interact with, they play a role. But then you have the next level at the community level. You have the schools, the churches, the workplace. All these institutions contribute to what we do. For example, if you have a workplace that promotes healthy lifestyles, so exercise and so on, and have a cafeteria with healthy foods, that makes a big difference as opposed to a workplace that does not have these sort of facility. So at the community institutional level, and then at the final level, you have your policymakers, and they're the ones who have the ultimate responsibility. The buck stops at your policymakers, because the population health activities that can benefit us has to be led by the policymaker. So for example, there's been a global movement towards smoking in public places. In Grenada, we have not yet passed the legislation that addresses these issues. So what we see now is based on moral suasion. So companies and organizations make it as a policy, okay, don't smoke inside the building. But it is not a law in Grenada as yet, based on the Tobacco Convention, the Global Tobacco Convention, and so on. I know there has been draft legislation for, I have to say, for years now, but it has not been placed in Parliament to really discuss. And I guess, you have to look at the stakeholders, and if the policymakers are not fully in tune with the need to stop smoking in public places, in restaurants and other public places, then they would not advocate for it. So some of these policy issues must be led by our leaders, our policymakers, our politicians, because policy is what really contributes to changing the pattern of behavior at the population level.
Great. So in terms of, let's look at the first level. What would you say to people at the first level as it relates to, being or having access to the best form of primary health care? So we're talking now about the family, people at the schools and that level. What do you say to them?
I will even put it within the context of COVID.
Right.
Because we are seeing COVID right now. And as individuals, we have to recognize that there are certain ways in which the virus is transmitted. We know definitely now that when you speak, when you cough, when you sneeze, you spit out certain droplets that stay in the air for a little while, especially if you are indoors in an air-conditioned building where you have groups of people together. The droplets become more effective. If you are not wearing a mask, you will be increasing your risk of being affected by these droplets. We realize that the surfaces and so on that we touch, once we maintain them being clean, once you wash your hands regularly, you minimize the risk of transmission. So we know the mode of transmission is primarily from person to person in these environments. So as individuals, we need to acknowledge our responsibility when we go in public places to wear the mask. And especially now that we have been faced with the reality that we had the 3 Trinidadians up here who have tested positive. And we have to understand the tests can can show that you still have the antibodies in you, but you might not be able to transmit and pass on the virus to another person. So that's one of the important reasons to have greater testing. You're going to be able to identify who have the antibodies and who are asymptomatic, they cannot pass it on. And really and truly, the latest research is showing that once around 20% of your population has the antibodies, then it is the threshold for herd immunity. And the research was based on what is happening in Sweden, where they did not maintain the curfew and didn't have as strict a regimen as in other countries. So it is interesting how the data is becoming clearer on the mode of transmission and the role of individuals in their behavior. So to really emphasize the point on prevention, as individuals, as families, we play a significant role in terms of addressing healthcare problems, but our behavior is an important element in our health status. And we have to realize that we have to take individual responsibility. We have to acknowledge the responsibility of our families and our communities, but our policymakers are the one who drive the policy to guide the population health issues.
Right. I want to ask you something, Kelly. As it really, well, and let me just ask you, people's attitude, people's behavior, people's actions, can that impact primary health? For example, we heard of a very serious accident, fatal accident yesterday, last evening in Wester Hall. 3 persons lost their lives, and there are some in critical condition. Would you say that people, for example, who drive irresponsibly, that is not in keeping with good primary health care? Is there a connection with that?
Well, Godfrey, I want to use the opportunity to extend condolences to the families who have lost their loved ones in this accident. It highlights the importance of road safety. We have seen a lot of accidents in recent years on the road where people are speeding and driving without that due care and attention. We're also seeing that some vehicles are not being properly maintained, because based on reports that I've read pertaining to this accident, apparently the garbage truck had some problems that led to the accident. So we have to look at it from different angles. We have to look at it from the speeding on the road, but you can acknowledge that sometimes you're doing what is right, you're doing what is safe, and then the behavior of the other driver leads to an accident, or as the term implies, an accident is generally not a voluntary something that you do, but it is clearly showing to us that we have to pay attention to our actions on the road. We have to drive within the speed limits, and 40 miles per hour outside the town, 40 miles per hour is fast in Grenada, really and truly. And we have to acknowledge that there are several factors that would contribute to things like the accident, and ensuring that vehicles, especially these public service vehicles that deal with garbage and so on, that they have some structures in place to ensure that they're properly maintained and reduce the likelihood of these sort of accidents. But it's really unfortunate what has happened.
But I'm asking about that because as we established at the beginning of the program, one of the main factors of primary health care is that of prevention. And when we have people who drive recklessly, they are not trying to prevent accidents.
Sometimes it's not the driver driving recklessly, but it is the vehicle that have other problems that you could be the best driver in the world, but if your brakes cut on you or you have a brake problem, there's very little you can really do to prevent an accident, you know?
Okay, all right. Okay, so we're going back to obligations, and we spoke about at the first level, at the policy level. I mean, there's quite a lot that has to be done. Let's talk a bit about that. One, in making facilities available to provide assistance to people who are sick. So let's talk there about that. What are the responsibilities of the policymakers in terms of making available facilities and whatever is needed to ensure that people enjoy good health?
Well, you're raising issues outside of the realm of primary health care now, because once you talk about curative care, once you talk about services like hospitalization, we have to acknowledge that there's a significant role that the policymakers need to play in terms of the curative health side of it. And what we must acknowledge is that our hospital services has a lot to be desired. We have been talking about our hospital for decades. Even the location of the hospital has been debated for years. We have to acknowledge the importance of having proper secondary health and tertiary health facilities, and in particular proper hospital. We know over the years there have been discussion about it, and especially because of the role of St. George's University in this country, there has been moves over time to collaborate in a public-private partnership to work towards a hospital that can really not just meet the needs of the Grenadian population, but be a benefit for us to market our tourism or elderly care tourism or long stay tourism. And in the same way that we have SGU here, we can have long-term healthcare facilities. We can attract Grenadians who are living in the diaspora who want to come home. We should be able to have top quality hospital services that would complement our primary healthcare facilities and ensure that the nation can use that as a leverage, as a point of best practice for us, because we have one of the top medical schools in the world. We are producing more doctors for the US market than any other university in the world. We are able to graduate students who are working all over the world and playing significant roles in the healthcare system of many countries. And we should use that as leverage to have a functional health system that is able to provide quality health services at all levels. And I think this is something that we need to aspire towards still.
Right. There is something I want to share with you, and I want you to comment on it, all right? It is said that primary health care also includes the key elements needed to improve health security and prevent health threats such as epidemics and antimicrobial resistance through such measures as community engagement and education, rational prescribing, and a core set of essential public health functions, including surveillance.
All right. Now, what you have said, let me simplify it for the ordinary man to understand what you say. What you're basically saying that every health system should ensure that the components of our health system works in harmony with each other. So, for example, proper surveillance means that you need adequate data. You need to be monitoring what is happening. And you do not just need to count the number of visits to a health center, the number of admissions in the hospital, the number of discharges. It's not just looking about the numbers, but looking at what are the health conditions that are affecting the population. Because once you have a good epidemiological profile, and the word epidemiology means the study of the distribution and the determinants of disease, what caused disease and how it is distributed in the population. So we know the epidemiology tells us that diabetes and hypertension is a big problem. Or epidemiology would tell us the amount of cases of influenza and scabies and other things that we see in the population. So epidemiology will tell us about how many operations for different health problems in the hospital. So our data is an important component for surveillance. But we also need to focus on our health workers. Our health workers play an important role in the delivery of care. So we need to ensure that when we talk about health workers, it is not just the doctors and nurses we're talking about. Health workers are spread throughout different sectors of the economy. So, for example, one of the areas that we tend to shortchange when it comes to health is the issue of mental health. How are we addressing the stresses of society from our school system? Do we have certified, trained counselors working with our children in the school system? Do we have an adequate amount of them to ensure that the services are addressed in a manner where the linkages with the parents and the household and the community is an integral part of that counseling and service that we provide in our school counseling system? So we have to try and ensure that our health workers are adequately addressed. How many of our family nurse practitioners do we have in our system? Family nurse practitioners is a category of health workers that play a significant role in terms of managing our chronic diseases. That program has almost been phased out, and I won't be surprised if the few public health family nurse practitioners we have are about to retire. What's about our community health nurses? What about our community health aides, who are the ones going out in the field? So we have to look at our health workers in a very important way as an integral part of our health system. Another area that plays a major role is in terms of our pharmaceuticals, and how do we ensure that the medication needed by our population is really provided to them. So procurement and management of our pharmaceuticals are critical. And of course, our healthcare financing. How do we pay for healthcare services? As we fully are aware, before this COVID situation in the world, the government has been talking about introducing national health insurance. Is it something that we still should consider on the front burner, or should we really look at strengthening our primary healthcare program? Should we be focusing on making sure that our district health services, our health centers, are functioning to the point where they're meeting the needs of the communities that they serve? How can we ensure that when people get sick, that they feel confident to go to the health center and access quality care, rather than depending on a private practitioner's office as the source for getting care? Sometimes the same practitioner that we go to in their private office have clinics in the community that is hard to access. So we really have to look at the services being delivered at the community level to ensure that people, when they need services, can feel comfortable to access them and not feel that it's a waste of time going to the health center, so I might as well borrow, beg, or thief the money to go and pay a private practitioner.
Right. One quick point before we go to a break. The issue of community engagement and education, because people need to be knowledgeable about things that can affect them. Lifestyles that can, affect them negatively, their health, that can impact their health negatively. How should we go about the community engagement and education?
Well, community engagement should be an integral part of life, not just relating to healthcare, but relating to our constitution, our governance, our involvement of the people in decision making, our need to understand what are the problems that affect our population so that we can come up with health policies and policies generally that would meet the needs of people. Unless you go to the public and talk with them, unless we go to the public and listen to them and hear their experiences. We need, for example, to let people tell their stories about access to health care. Every family has a story about how a family member needed health services and the stories that they have about how they go about it. I remember, tons of stories as I move around the country of families not able to pay providers to access care in a timely manner. I've heard stories of families whose a child in the family has a hernia. They need to get it repaired. But when they go through the public system, they're given an appointment 5, 6, 10 months down the road. But if you pay the same physician, you can get access to that service next week in the same government hospital, government operating room. It shows that something is wrong between that public and private relationship. Why should somebody be prevented from accessing care in a timely manner because they go through the public system? But once you can come up with the money, you can get it in the private system. It means that poor people who cannot come up with that money, is prevented from accessing care in a timely manner. And when that happens, it delays the problem, it gets worse, and later on, it's really more problem to the family.
But
so that community engagement is critical to healthcare.
But how do you deal with a problem like that? Because clearly, you cannot blame a private practitioner from doing what they worked hard to do. They have that's their job, that's their profession. So I don't know that you can fault a medical professional for doing that. But how do you deal with that issue?
Now, this is where one of the key elements of a health system is governance and leadership. Now, if you have leadership in our health sector who is not really knowledgeable about the big picture, they will not be in a position, no matter how well-intentioned they would not be in a position to lead with clarity, lead with purpose, lead with conviction, lead based on a vision of improving the health sector of the population. They will be fighting fires continuously and hoping for the best. So we have to acknowledge the importance of leadership, of vision, of clarity of thought in terms of the direction that the country needs to go, and try to put measures in place that would facilitate working together with the public sector, the private sector, the non-governmental sector, and in particular, the community. So your previous question about the linkage with the community is critical to ensuring that we provide services that is in line with the needs of the population.
Okay, so let's take a commercial break, and we're going to come back because we have a lot more to discuss. Stay with us, folks. We'll be back with you in just a moment.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carriacou, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica, Trinidad, and beyond. Capturing the latest in news, sports, weather, and entertainment. Credible, informative. Thank you for making us number one. News at 7, live, Monday to Friday on GBN Television, Channel 7 and 11, K105.5 and 105.9, Hot 98.5 and 98.7, GBN Television Facebook page and YouTube channel, and www.gbn.gd. GBN, with you anywhere and everywhere.
You've spoken. We have heard. Now we're making more time available for your evening primetime shows on K105. From Monday, July 6th, Your Law will air from 6 to 7 p.m. On Tuesdays, Simply Agriculture. And on Wednesdays, join discussions on constitution reform in partnership with Island Media. At 5:55 p.m., we bring you news headlines, a capsule on local, regional, and international events, followed by news at 7 via simulcast with GBN Television. Join Godfrey Augustine for stimulating discussions on Release It from 8 p.m. on Wednesdays and Thursdays. GBN's K105.5 and 105.9. We're with you everywhere and anywhere. If you're on the move, catch us online at www.gbn.gd.
Let's Cook Grenada, a practical culinary guide to local cuisine. Learn new ways to prepare your favorite foods or try different menus from various locations across the island. Let's Cook, Tuesdays at 8 p.m. on GBN Television, Channel 7 and 11, GBN's Facebook page, and GBN's YouTube channel. If you miss it, catch the repeat Thursdays at 10 a.m. and Sundays at 3:30 p.m.
And welcome to the OECS Link.
A conversation is a talk. It's important to know where we've been to know where we're going.
Hello, Dr. Jules.
Hi, how are you?
Join us every week on this station as we build relationships that uplift our region. Find us on all social media platforms. The OECS Link is powered by Republic Bank.
Welcome back. It's Doctor and Call, and time moving on quickly to 18 minutes on past the hour of 9 o'clock. If you're just joining us, Mr. Kennedy Roberts, he's with us this evening. He's a public health lecturer at St. George's University. We're talking about primary health care, and we've touched quite a few issues here as it relates to that. Kennedy, primary health care has been proven to be highly effective and efficient way to address the main causes and risks of poor health and well-being today, as well as handling the emerging challenges that threaten health and well-being tomorrow. It has also been shown to be a good value investment, as there is evidence that quality primary health care reduces total health care costs and improves efficiency by reducing hospital emissions.
Godfrey, as I listen to you, several things come to mind, and of course, chronic diseases.
Yes.
You know, every family in Grenada can identify with somebody having diabetes or hypertension. In Grenada, we have seen over the last maybe 2 decades a constant increase in our chronic diseases, and I don't think we have really addressed, not just in Grenada but in the Caribbean, we have not really addressed some way of reducing that growth and reducing that trend. And I sincerely believe that our approach has to be medium to long term and must target our school system. We must target what we call a life cycle approach to our human development, where we have to acknowledge that the lifestyle and behavior of our adults is going to be difficult to change now. No matter what you tell Grenadians, they're still going out there and drinking alcohol to a level that is impacting their health status. We have people, and men in particular, who don't even know their status. They're diabetic and they don't even know it. They're hypertensive and they don't even know it. And they go out there consuming alcohol, smoking cigarettes, and living a lifestyle contrary to what is needed to address those health problems. So we definitely have to target young people. We have to target education as the mechanism to inform and educate our population. We have to get people to see the linkages between lifestyle and health problems. We have to make young people acknowledge that being diabetic doesn't start when you're 40, when you're tested, but when you're in your teens and when you're in your 20s, you're building up you're clogging up your arteries based on your behavior. So primary health care and prevention programs need to become an integral part of our activities. And health must not be seen as a Ministry of Health activity, but health must be seen as an integral part of our school system, our workplace, our communities, our farms, everywhere that we work, we play, we socialize, must have a health component. Health must be seen as contributing to every facet of our development. And in order to have a change in this chronic diseases and in our health patterns, we need to now zero in on prevention at the school level, at the maternal and child health level, from pregnant women onward.
You know, Kennedy, I was listening to you there, and quite some interesting things came out. And I wanted to come back home to the COVID-19 situation. Recently, when the curfew was lifted, we heard of a carnival-like nature activity happening in Bathway. You want to speak to that as it relates to primary health and prevention?
Well, it comes down to human behavior. When you're in a lockdown for a prolonged period of time and you get the false sense of security, you hear the pronouncements, we do not have COVID virus in Grenada, we're COVID free. And people, we have to realize that we are in tune with social media at a global level. When you're seeing what is going on in the US now with the transmission, and you acknowledge that, yes, people are moving up and down the place, they're not adhering to the things, and they're transmitting it left, right, and center, you see that condition. But when you hear that in Grenada we do not have it, and you're aware that you can only transmit it if you have it, it leads us to a false sense of security. So people want stress relief. Remember, this is usually our carnival period. Usually at this time in Grenada, up to last year, we have fete every night. We have different social activities to enable people to release their stress. We are not doing it now. And on the contrary, we have had a law enforcement approach to management of COVID, where they are arresting people, charging people, preventing people from doing the things that they normally do. And this approach is creating a lot of mental stress for people. So we have to acknowledge that, yes, the government has a role and responsibility to maintain the health of the population. But at the same time, we see what is happening in St. Vincent, where the government doesn't have the curfew and the state of emergency and the sort of law enforcement approach, but they have used a much more education and health promotion and information element that tells the population, listen, this is our reality, behave in a particular way. And as a result, I listened to Prime Minister Rob Gonzalez this morning on another radio program, and he was making it clear that the population of St. Vincent not going on no beach and have no big set of activities because they know the situation. But because of the way in which we had the absolute lockdown, and now people feel that they have a little flexibility, that's why we're seeing the mass gatherings and so on, because we're human beings and this is human nature. That is why the gradual approach of education, showing love, letting the people understand why we're doing what we're doing, and giving them clear guidance on what they should not be doing, that sort of leadership, it will make a major difference.
But what about people's responsibility to their own selves? I mean, I hear what you say, and I don't want to move away from what we're talking about, but I do also believe people have a responsibility to themselves to be safe. The fact is, if you don't exercise that responsibility, because you feel that you've been in a lockdown and you stressed and you go out there and God forbid something dangerous happens, then the very people who you have been criticizing for the lockdown, you now have to go back to the very said people to help deal with your situation for you and to assist you. So what about people's responsibility? Because we spoke earlier about obligations at different levels, at the level 1 and at the third level, the policy makers. So what about in cases like that? What about people's responsibility to themselves as it relates to their health?
But remember, we were just saying that the government made it known to the population that for several weeks we had no cases and they said we were COVID free. So human nature is that, okay, we know they're about to open up the borders. We know there are going to be new cases coming into the country. But if we're saying now that there are no cases, a lot of people feel that that is a passport to say, well, okay, we can have a little free up. However, the pattern of behavior can lead to us being complacent later on. And we know that COVID is real. But we also know, Godfrey, that most people, over 80% of the people who contract the virus have mild, moderate symptoms and do not need to be hospitalized. And on the 20% that need to be hospitalized, only a very small percentage need to go on in the intensive care unit and use a ventilator. So we have to acknowledge that the risk is not as great as we really, some people think it is. And striking that balance between being fearful and being paranoid about what COVID can do and not acknowledging that there's a certain science behind it, how it can be transmitted, how we need to protect ourselves. So yes, by wearing the mask, it reduces the potential of you being exposed to the virus. So that is why the wearing of the mask is recommending. The social distance in the absence of a mask would have a positive impact. But the fact that people have been going out and socializing and doing things mean that our education programs has not been as successful, but we have given people a false sense of security.
All right. We're going to open our telephone line. I know the people, it has been going actually. The number is 435-2041. We're going to take whatever questions people may have at this time. Or if, you would like to make a contribution to the program, we'll accommodate them. So we go to the telephone now. Dr. and Paul, good evening.
Good evening, Godfrey, and good evening, Mr. Roberts.
Go ahead, please. Can you speak a little louder? Thank you.
I said good evening, Godfrey, and good evening, Mr. Roberts. Hello, are you hearing me?
Yes, we're hearing you. Go ahead.
Right. Primary health care, not a problem. The problem is people mindset. And I'm going to take you back some years ago. Somewhere around 1995, 96, or 94, 95, 96, thereabout, after the U.S. Office of Foreign Disaster Assistance, they did a lot of work in Grenada. And it had to do with disaster awareness. It is interesting to note that the target group at that time was principals. So you're talking about 95 to now. And the main objective was to get that information, the shaping of these young minds as to our vulnerability, so we can build resistance and resilience.
Right.
Now, the issue is that because of policy, these information, this training, these assets never trickle off to meet the target group. So we never had a continuous process. We never had that state of mind and awareness as to be prepared in the environment in which you live. Today, look at COVID-19. And I wouldn't talk about Grenada's response to Ivan and Emily, even though a lot of financial resources come our way. And I'm troubled now that because of our behavior or action, we would have some tough road ahead. But look at COVID-19. COVID-19, the challenge of COVID-19 encompass all human endeavors. And let me say this. Disasters fall in two categories: man-made and natural. When it is natural, your methodology is mitigation. When it is man-made, or for man-made, your methodology is prevention. Look at the challenge of COVID-19. It encompasses both of them. The challenge take up both of them. So your approach for COVID-19 is not as simple as, say, like a hurricane or maybe an earthquake or something like that. No. What I'm saying here is, if since in 1994 or 95, thereabout, that kind of awareness, that education has gone through where it's supposed to be, the channels that it's supposed to be in and to go through. Today, we would have a better nation with greater asset in terms of knowledge to apply themselves whenever any event or situations befall us. Unfortunately, we are not there. So we become extremely vulnerable. And primary health care is not only, well, hypertension or diabetes, or you get, infections by pathogens, whatever have you. It also has to do with your lifestyle, your mindset, and how you approach life on a daily basis. And that, again, has to do with knowledge, education. Thank you very much.
Thank you, Cora. Thank you very much indeed.
My brother, you said so many different things there that resonates with our reality now. The continuity of programs is one of the issues that we've heard, not just in Grenada, but throughout countries of the world. When a government change, they put aside programs. We look at the behavior of young people in society now. And we would remember that in 2011, 2010, the Ministry of Education had put out a set of booklets on behavior and acknowledging how we need to deal with conflict resolution and these sort of issues, the softer skills. The books are in boxes in the Ministry of Education. They're not being utilized. So how can we expect our children to behave in a particular way if they're not trained to do that? we must look at training and education as something that is not just about passing an exam, but it's about the life skills. It's about conflict resolution and how we relate to each other. We have too many examples in our community now where conflict resolution could have led to lives saved. But because of the lack of understanding of how to deal with conflict, we see the murders and the violence in our society. So we have to realize that people's behavior is a reflection of the education system and the knowledge that they have in terms of how to deal with these things. And we have to make that an integral part of our education system, because you can only behave in a particular manner if you're trained and exposed to that best practice.
Okay, let's go back to a telephone. Dr. Nkor, good evening.
Yeah, good evening, Mr. Godfrey.
Yes, good evening. Go ahead, please.
All right. Let me just turn on my television. Right. So good night to Mr. Godfrey Augustine, and good night to your guests. Well, I did not join the program too early, so I did not hear much of the things that were said. But what I did hear, Mr. What's his name again?
Roberts.
Right, Mr. Roberts. Yeah, Mr. Roberts was speaking about some of the things that is happening right now in relation to the COVID and some people being very irresponsible and so on. Right. So what I would like to say is that I think it was presumptuous of the Ministry of Health and the health officials to come out and just declare that Grenada is COVID-free. I think it was really, it's sort of irresponsible on their part to do so. But at the same time, I think that the Grenadian people were also very much irresponsible. For example, when we heard that they had this big party or whatever it was in Batway, I think it was really, really irresponsible of the Grenadian people to do these things. And as Mr. Roberts was saying, even the men, he was talking about the men who are consuming a lot of alcohol at this time. And it is very true. I mean, I see that all the time. I was on the in town today, no, not today, yesterday, and I was speaking to a couple of people. They were drinking alcohol right by at the side of the road, right in town, on the streets. And I spoke to them about that. So people have to be more responsible. People have to understand that we are not living in normal times right now. And people also have to understand that we would not really be going back to normal times. And if we continue to be irresponsible, we could have a worse situation on our hands. And we have to be so thankful to God that we had, how many cases did we have? Was it 23? And we had no deaths. And I have been calling for, I know we had the churches, had the Conference of Churches and the Alliance of Evangelical Churches and the government had called for a national day of prayer and repentance and so on. But I have been calling for a national day of thanksgiving, praise and thanksgiving, for the very reason that God has been so good to us here in Grenada, in our nation, that not one person who was tested positive for the virus, nobody died. And not only that, all the persons who were had the virus, they recovered. So I'm using this medium, Mr. Godfrey, to send out a call again. I know that the Alliance of Evangelical Churches is working and having that done, but I think the process needs to be speed up so that we can have a national day of praise and thanksgiving unto God for being so gracious and so good to us.
Thank you very much indeed, caller. Thanks a lot. Yeah. Candy, I want to, before you go, I want to say something, because and I think we need to put it into context. And you mentioned it, and the caller just mentioned it, that the authorities declared Grenada COVID-free. Isn't that based on the positive test that was done, or the test that came back positive for COVID? Because I think it would be. You see, I don't want us to send. Give people the wrong impression, and I'm thinking here that the announcement that was made as it relates to not having COVID is based on the fact that all the tests that was done, because that's the only how you can determine it, that all the tests that was done, we had 23 positive cases and the rest were negative. To come out openly and say that we do not have any cases of COVID, that to me, I'm not sure we can do that. So I just want to put in the context that from what I understand, the announcements that were made were based on the amount of tests that was done. So at the same time, I don't think people should be that irresponsible to think, well, okay, an announcement was made that we don't have COVID in Grenada, so they can do anything.
Yeah, Godfrey, that is why the point that if you do not test, you would not get any new cases. Because, of course, if you go along for 4 weeks and you didn't test anybody in the population. So, for example, someone was asking me today, if we realize that these 3 Trinidadians who are up here have now tested positive, should we be targeting other Trinidadians who might have, or persons who might have come up from Trinidad during that period before lockdown, to see if they came with the virus also and is now asymptomatic?
But aren't there, quite a number of tests been done presently? Because even the news this evening, there was a report that from the amount of tests done so far, 50 of them came back negative. So I from what I understand, tests have been done presently.
Yeah, but it's on the contact tracing of the 3 Trinidadians. However, my point is, the people who came up on that same flight with them prior to the lockdown, should we target them and test them?
Yes, I think we should.
Should we be targeting people, Grenadians who are on the front line? We have all these people from Ports Authority and Tourism Authority and the taxi drivers and the hotel workers who are interacting with the people who came in on the cruise ship. We're having these people working and not being tested. So should the government have a protocol to ensure that testing continues and those who are higher risk should be tested, even if just to validate that they are not positive?
Mm-hmm.
So we need to ensure that the protocol for testing is much broader than just who we see come in and have the major symptoms, but those who are in the front line should also be prioritized for testing.
Okay, let's go back to our telephone. Dr. Encore, good evening.
Hey, citizen, greetings. How are you?
Very good. Go ahead.
I'm happy to hear that. Mr. Roberts, greetings. Listen, every time, I must indeed say, Mr. Roberts, Citizen Roberts, I prefer to call you so because I believe you. Every time I hear you talk, I feel pleased because you really do say it, my dear brother, and I wish that one day in this here country, people like you will have the opportunity to serve us in the way that you know how to do it. I do confide in you. Every time I hear the term public, how you call it? Not public, pardon, primary health care. I remember the Soviet Union, the communists, those evil people. And I remember where primary health care, the concept, was sold, or no, let's retract that verb, sold, was placed forward or put forward to the world by the WHO. That happened in a place called Almaty. Today's Almaty. Where was that again? Which one?
Alma-Ata.
Well, it was Alma-Ata then, but today it's called Almaty in Kazakhstan, isn't it?
Kazakhstan.
Huh?
Yes, you're right.
Anyway, that was in 76. You remember the day? That was the day the commies were raiding. Huh?
It was 1978.
So many of you saying, well, there we go, great. So you see, I'm kind of remember, I tried to see. Listen, Robbie, we have failed. We have failed with all 40, how many years? That would be 42 years, isn't it? There we go. Let me see, 10. Yeah. We have failed miserably. And you know what pains me in this here country? With all the assistance we have received from a country that was has been to date so successful in developing a health system, a preventative health system, a curative health system, even development of medicines and otherwise. With all the assistance we have referred to the country of Cuba. And from all the assistance given from other countries, we have not been able to build even the basis of the primary health care system in this here country. You certainly would understand that. You do not say directly, but when you speak of the failures and up to today, our inefficiencies and deficiencies in the health system today in this here country, a man gets sick. In other words, let's put it in Grenadian, and a fella, quote unquote, take in his village, he had to make sure and pass by Otway and Lockwa. Now, what do we do to change this, Mr. Roberts? What do you reckon is the best thing? This is my question to you. No, I know you speak from your heart. Tell me the truth. What do we do to change this so that we can inculcate in our people from whatever level that they can understand the health of the nation is the wealth of a nation? Give me some views on that. Thank you.
Thank you very much indeed. Yes.
I would make the answer consistent with one of the things that I admire you advocating for over the years, and it is consultation with your people. We can only understand the needs of the people when we talk to our people. We have Grenadians out there who have stories about health that would give us a clear indication as to what problems we need to address. So when, for example, the thrust prior to COVID was national health insurance, I was saying for 25 years I've been advocating it, but at this point in time, national health insurance cannot be the priority, but primary health care, prevention, community involvement, community responsibility, integrating health in every aspect of life. We have to think of health as something that is linked with agriculture, with education, with communications and works and construction and infrastructure. Everything has to be put within the context, what is the health implication of what we're doing? So that health is not an abstract thing that when we get sick, we say how much people go to the hospital and how much people need to go to the doctor. But our health indicators should tell us about wellness and try to ensure that the people of Grenada has a mindset of wellness, and rather than behaving in a manner where they don't know what the impact of their behavior is going to do to the health status. So we can get families to think about what they're cooking today and how nutritious it is for the children. We can get families to think of what are we planting outside. And you know, I was telling Godfrey before the program that, you know, this COVID experience has encouraged me to plant a lot more than I've planted before. So I am producing a lot more food than I have ever produced in my life. And it is such a beautiful thing when you can give away lettuce and avocados and okra and other things. And I have my 500 plus corn flour in and getting ready to, you know, these sort of things is what we need to go back to. We need to encourage every household to plant something around their home. Godfrey, you are telling me you have much land, but you're using pallet and tire and other things to produce food. So we have to create a mindset of wellness, a mindset of food that is nutritious, that is grown locally. And in so doing, we're reducing our import bill, we're improving our health status, we're improving our community relations, we're improving the camaraderie in communities and families, and there is so much more benefit to us focusing on ourselves and the basic things about life. So, Brother Rolo, we need to then go back to our communities, involve people, communicate, and make people feel that they're not a statistic, but they're real human beings who have desires, who have feelings. And once we work with communities and we show people the love, I think our future is going to be a lot brighter.
Okay, let's go back to the telephone again. Dr. Call, good evening.
Good evening.
Good evening, caller.
Yes. Earlier on, Mr. Roberts alluded to the fact that people with chronic diseases have a compromised situation, and then they're doing things they don't know they don't know they have these sicknesses, and they're doing things contrary to the sickness, which is a compromise to the health. Now, this is taking place on a massive scale in Grenada, and it must have to do with education. And the second thing I would like to mention is that going on to the COVID situation, the contact tracing. Now, if someone were in contact with the people who went back to Trinidad in the last 5 days, for example, and they are tested, they would come back negative for now, and they have already been tested, because the 14 days it is not 14 days as yet. So when you test people now, and you don't go back and test them a second time or a third time, they could have the sickness in them, and you don't know, because there's no length of time pass. You have tested them 5 days after they came in contact with the people who went back to Trinidad. The point I'm making is that the time hasn't elapsed sufficiently to find them positive. That's the point I'm making. Thank you very much.
Thank you, caller. Thanks. Yes.
We have to acknowledge, though, that the Trinidadians probably have been exposed to that for several weeks or even months. And in this last several weeks interacting with people in the community, it is a very low probability that they would have passed it on. So what we have been seeing is that very early in the stage of having the virus and very late, you might not be passing it on as easily. So the persons would have had the antibodies. They're going to test that, yes, they have the virus in them, but the ability to transmit it is extremely low. So the people who they have been in contact with will more than likely, and from what I've heard, most of them, if not all of them, have been negative, but we're going to wait and see the outcome. But you're correct in the sense that there are other people out there. It is highly possible that there are other people out there who have the virus in them. But we have to acknowledge that the mode of transmission is such that the longer you stay with it in your system, you will maintain the antibodies but not be able to pass it on easily.
Okay, let's get back to a telephone. Dr. and call, good evening.
Good evening.
Go ahead, please.
Godfrey and your guest. I'm seeing another dimension to the story. It seems to me that Grenadians believe generally that those 3 Trinidadians, they were originally infected and brought this thing come here. But there is another way of seeing it. What if 1 or 2 or maybe 3 of them could have gotten infected much here in Grenada? Think of that. Thank you.
Thank you very much. Okay.
Yes, and of course we have to acknowledge that that is also a possibility. But the fact that they were not expressing any symptoms and we were not aware of it in Grenada for a prolonged period of time means that the risk of transmitting it has become less. That doesn't mean we should be complacent and not, because this COVID thing is changing so rapidly on a daily basis, weekly basis. You're hearing different bits of information. So we cannot say with total certainty that they're not able to transmit it to others. But so far, based on the fact that they've tried to do contact tracing and tested those persons who they know was in contact is one angle. But I think we have to start testing other people in the front line and even other Trinidadians who might have come up here around the same time.
Yes, indeed. So let's take our final call for this evening on the program. Dr. and call, good evening. Hello.
Good afternoon, Mr. Godfrey.
Yes, go ahead, please, caller.
Good afternoon, Mr. Roberts.
Good evening.
And how are you?
Very blessed.
Yeah, something I want to ask. Mr. Robert, the amount of people who are dying now, old as well, I can't say old people. When you listen to the death news, sometime in the morning time, and afternoon time. The amount of people who are dying now, don't you think you don't have people who are dying with the virus? I do believe you have people dying with the virus. Because when somebody dies, they call the agency, they call Godfrey, they call Wayne, they come, they pick them, they take them and they go with them. I want to know if when they bring them go in the place, if it does happen to them. So this thing is a thing that was spread in Grenada here. We just have to be careful and mindset about this COVID-19 business day.
Thank you very much. Thanks a lot indeed.
Caller, you made the point, which is very true, that the people who get seriously ill and die tend to have some other condition or fall in the category of the elderly where the immune system is very compromised. Most of the healthy young persons, the majority, 80% plus, usually have mild, moderate symptoms and do not need any hospitalization. So we have to acknowledge that this is not something like the smallpox epidemic of 1902 and the epidemic of 1918. We have to acknowledge that this is real. It is affecting a lot of people. It is killing a lot of people in the U.S. right now. But when you look at other countries of the world, you have to ask, is the practice, the behavior in the U.S. consistent with what would prevent the spread? Or is it that people's individual rights and freedom has dominated the U.S. landscape, and as a result, transmission is a lot easier? Because when you look at the number of cases in the U.S., compared to other countries of the world now, South Korea, Taiwan, and other centers that have huge populations but has a different result, you have to ask the question, is it something that the U.S. is not doing in terms of public health? Is it something that is not happening in terms of the leadership of the process at the federal level that is creating that major problem in the U.S. now? So in the Grenada context, I think we're fortunate not to have had any deaths. We're fortunate not to have had so many cases, but I think we need to do the tests and try and ensure that we have a better grasp on the information as to who have the antibodies.
Okay, thank you very much. And Mr. Roberts, that's all the time we have, but I just want to give you 30 seconds just to briefly remind people what is, when we speak of primary health care, what do we mean, and quickly the importance of it, so we can really send that point home.
Well, Godfrey, I want our listeners to realize that our individual personal behavior plays a big role. But what we do in our families, in our communities, in our workplace also plays a major role in terms of the health status of the population. But most importantly, our policymakers are in the best position to set the tone, and it must be done in a manner that is consistent with best practice. So consultation with your people is important. Collaborating with your health workers and making them feel a part of the process is critical. Ensuring that health is ingrained in everything that we do, and ensure that our lifestyle is in line with what we know is best practice. So moderate in alcohol use, don't get involved in tobacco, try to focus on maintaining our stress levels on a daily basis, and try to do things that maintains our peace and love and harmony with our everyone that we encounter.
All right, so Kennedy, thank you so very much, for accepting the invitation on short notice. I really do appreciate it, and I am inviting you to be on our agricultural program to share with us all the wonderful things you're doing up there. So we're looking forward to have you.
Certainly, and I'll have to take a few videos so we have some clips in between.
Definitely.
Agriculture is not about talking it, it's about doing it.
All right, lovely. Thank you once again, and have a good night. All the best, yes?
Blessings and All the best to you too.
Yeah, thank you very much. All right, folks. Thank you for staying with us, for viewing, and for listening. That's our program this evening. Do have a good night. I'll be back with you tomorrow. It's Wednesday. Tomorrow being our Wednesday edition of Release It. There's a lot to talk about, so be sure to join me then. Until then, have a good night. All the best.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of the way, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Caranage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Caranage, St. George's.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer.
GBN Television News at 7, a pulse on all things Grenadian. Look out for our new features through expanded synergies with our media partners in Barbados, St. Lucia, Jamaica,